Hello everyone, and thank you for joining the 2025 Open Enrollment Briefing. My name is Janelle Marzai, the Healthcare Facilitator in Human Resources. This presentation is a high-level overview of the 2025 Open Enrollment changes. Open enrollment starts Thursday, October 31st at 8 a.m. and ends Friday, November 22nd at 5 p.m. Open enrollment is the time to make a change or enroll in a medical, dental, vision, and legal plan, add eligible family members and medical, dental, vision, or legal, enroll in health and/or dependent care FSA, start or change contribution to health savings, learn more about your plans. Reminder, if you do not wish to make any changes, you do not need to take any action. Except for a health savings and/or dependent FSA, you must re-enroll each year. Your current insurance coverage will continue, but costs may change. All health plans will continue in 2025. The 2025 medical plan premium rates, the premium rates will be published on October 24th on the UCNet Open Enrollment website. Ask Alex. The Alex tool will also be available with the new 2025 rates on October 24th, and it also will be available in Spanish. Here are the 2025 Employee Premium Cost Share System-Wide Bargaining Units. XX, HX, RX, SX, TX. 2025 employee contributions will be held at each bargaining unit's 2024 levels. Negotiations of the union contracts for bargaining units will open contracts is underway, and any conclusion resulting in the change to the new rates currently in place will be announced separately following the settlement of each contract. System-wide bargaining units will move to the 2025 premium cost share and pay band levels, with some units having a $25 a month increase cap above 2024 for Kaiser and UC Blue and Gold HMO plans. NX cap applies to all salary bands. CX cap only applies to salary bands 1 and 2. Also, if one is in a union and not sure about their premium costs, the UC Benefits Decision Tool, Alex, can help. Alex will ask a few questions, then provide rates specific to each employee, including those who are in unions. For the 2025 pay bands, there is a pay band increase. The pay band threshold adjusted each year based on the Consumer Price Index from California Department of Finance Index for urban wage earners and clerical workers. The increases in salary and the pay band will range from $3,000 to $6,000 per pay band. The definition of range for the 2025 medical contribution base using full-time salary as of January 2024. New for 2025 is the employee contribution to core PPO. To ensure that the cost of the medical coverage is shared fairly, the core PPO plan will require an employee premium contribution beginning in 2025. Contributions for core will be the lowest of the UC medical options, but this will be significant adjustment for UC employees who have appreciated the option of a plan that did not require a premium contribution. There will be targeted communication to those who are currently enrolled in core. HMO plan changes. Blue and Gold and Kaiser HMO. Doula services is now a covered benefit, 11 visits per pregnancy at zero cost. After the 11th visit, member pays for full cost of services. For those of you who don't know what a doula is, the doula is a professional trained in childbirth who provides emotional, physical, and educational support to a pregnant person who is expecting, is experiencing labor, or has recently given birth. For UC Blue and Gold plan, there will be an increase of copay for office visits, urgent care, and behavioral health visits. Acupuncture and chiropractic visits will remain the same. My Strength digital tool is a rebranding to Teladoc Mental Health. For the UC Blue and Gold plan, starting in 2025, there will be an increase in copay for all pharmacy drug tiers. There will also be a new pharmacy drug tier, tier 4 specialty drugs, and that will be 30% coinsurance up to $150 maximum per prescription. Our next HMO plan is Kaiser. We don't have a large amount of employees enrolled in this plan. However, I will discuss the changes. There will be a copay increase for office visits, urgent care, behavioral health, and emergency room visits. Acupuncture and chiropractor copay will remain the same. Starting in 2025, there will be an increase in copay for all pharmacy drug tiers. There will also be a new pharmacy drug tier, tier 4 specialty drugs, and that will be 30% coinsurance up to $150 max per prescription. Let's move on to our PPO plans. The UC Health Savings Plan will see an increase in HSA contribution, $4,300 self-only, $8,550 for family coverage. Same catch-up contribution, no change, $1,000.55 for our members 55 and over. Same UC contribution for the year, $500 for single or $1,000 for family. Same HSA custodian, health equity. UC Health Savings Plan, the in-network deductible, there's a slight increase, $1,650 for self-only coverage, $3,300 for family coverage, and the out-of-network deductible remains the same. Copay for Accolade, Care Telehealth, and virtual visits, it will be a $30 copay for all visits, and that does count towards your deductible. Core PPO plan, no plan design changes for 2025. The core plan will have a monthly premium in 2025. Please check the medical premium chart and pay band to view your monthly cost. For the UC Care plan, there will be a copay increase for office visits, urgent care, behavioral health, and pharmacy. Emergency room visits copay will remain the same. There will be a new pharmacy drug tier, tier 4 for specialty drugs. We will look at the pharmacy benefit in more detail in the next slide. For UC Care, here's the pharmacy table with the copay increases for each drug tier. Tier 4 specialty drugs will be 30% coinsurance with a $150 max per prescription drug with a 30-day supply. For Delta Dental HMO and Delta Dental PPO, there are no 2025 changes to benefits. For Vision Service Plan VSP, no benefit changes for 2025. Let's move on to our UC supplemental plans: accident, critical illness, and hospital indemnity, which plans are administered by Prudential. First, accident. No premium changes for 2025. New benefits is the $1,200 ICU hospital admission benefit. Enhanced benefits is UC hospital confinement benefit increases to a maximum of 10 per calendar year, and non-ICU hospital confinement benefit increases to a maximum of 10 per calendar year. Please visit ucplus.com to learn more about the benefits offered by each plan with Prudential. For critical illness, no premium changes for 2025. The enhanced benefits is the recurrence provision. The waiting period for a benefit payment after a positive diagnosis of an illness or procedure has been reduced from 6 months to 90 days. For hospital indemnity, no premium changes for 2025. New benefit is the ICU admission, $1,200. The enhanced benefits is hospital admission increases to a maximum of 10 per calendar year. Hospital confinement increases to a maximum of 10 per calendar year. Hospital ICU confinement increases to a maximum of 10 per calendar year. And substance abuse exclusion for hospitalization with advice of doctor removed. And again, please visit ucplus.com to learn more about the benefits offered by each plan with Prudential. All right, next is legal. There's going to be no rate and benefit change for 2025, and it is open for open enrollment. Next is disability through Lincoln Financial Group. No benefit or rate changes for 2025. Not open for open enrollment during open enrollment. Apply anytime with EOI. And life insurance and AD&D through Prudential. No benefit or rate change for 2025. Life insurance is not open during open enrollment. Enrollment and changes to your AD&D is always open. Next is the flexible spending accounts, FSA. The SFA contribution increased to $3,200, which is about a $150 increase from 2024. The health FSA carryover limit is $640 for carryover from 2024 to 2025 plan year. The 2025 dependent care FSA contribution is $5,000 for non-highly compensated employees, which remains the same from last year. $2,500 for highly compensated employees as defined by the IRS. Please take a look at the run-out period filing deadlines for health FSA in 2024 and the dependent care FSA filing deadlines. All right, open enrollment resources. Please check out the open enrollment website for more content and resources. If you have any open enrollment questions, please open a ServiceNow ticket. To make any updates or changes for open enrollment, please visit UCPath to submit open enrollment changes. And ask Alex. The Alex tool can help you review all your options and show you premium contributions for your medical plan options, customized to your location, salary, and union membership. Here is the upcoming communication announcements for open enrollment 2025. October 2nd, the OE booklets, files sent to printer, the final data is pulled. October 14th and 16th, OE preview article, which will be English and Spanish. October 24th, print mailers will be mailed. Alex tool will be updated with the new 2025 rates. The week of October 21st, the OE website goes live. October 31st, UCNet article, open enrollment is here. November 1st, new dimensions, which will be highlights for retirees. November 13th, UCNet and UC Network, open enrollment ends Friday, November 22nd. And November 18th, UCNet final reminder, open enrollment ends Friday at 5 p.m. Please note, timeline does not include UCPath emails. All right, next is UCPath communication. This is going to be communication sent out from UCPath to these specific groups. First is starting in October, November. This first slide is going to be the unpaid leave of absence and short work break mailings, TME open enrollment notice, unpaid leave of absence, short work break mailing, and unpaid leave of absence, short work break mailing. All right, so continuing the communication that's sent out from UCPath in November is going to be the TME flexible spending accounts, FSA enrollment reminders, TME health savings account HSA enrollment reminder, TME dependent care first notice, unpaid leave of absence short break mailing, TME submission reminder, and unpaid leave of absence short work break mailing. And the UCPath communication in December will be the TME dependent care second notice and the open enrollment confirmation statements that will be to be announced. Next is the open enrollment flyer, which will be published on October 24th on the benefits page on the HR website, and the link to the flyer will be listed on the communication that we'll be sending out to campus on October 24th. This flyer is a great resource. It has all the links you need to learn more about your benefits. Thank you for joining.